One is a difficult process for everyone, no matter what the age is, but most complicated for young people, especially when they're coping with the loss of a parent or an immediate sibling. Here in the Bronx, Calvary Hospice's bereavement program helps children and teens remember the lives of their lost family members, but also encourages them to know it's okay to have fun. Director of Calvary's Hospice Bereavement Services, Dr. Schachter, now joins us on the show to explain just how they assist in easing in the grieving process. And Dr. Schachter, thank you so much.
Thank you.
When you talk about bereavement, it's already a rough subject for anybody, but more particularly for children, because your mind just might not be ready to cope with the process. I know you guys are pretty intensive in how you deal. Share with us a little bit about assisting young people in this bereavement process.
Well, you know, it's interesting because years ago we used to think that children didn't need to know, they didn't understand, we didn't have to really explain to them about bereavement or about what happens when someone dies. But over the years through research we realized that that's not true. Children, especially young children, are very egocentric. So the three questions that they have when someone is dying or has died is, you know, did I cause it to happen? Because kids believe in magical thinking. If I wish for a bicycle for my birthday and a bicycle is there, then wow, what I wish for happens. So if I have a fight with my brother and I tell him, I wish you were dead, and then my brother dies, did I cause that to happen? Tremendous guilt that children have. So did I cause it to happen? Will it happen to me? And who's going to take care of me? So children, if they're old enough to love, they're old enough to grieve, and we have to pay attention to that and to be able to prepare children both during a process, if it's an illness such as cancer and we have the opportunity, or after a death.
So children, we talk about the grieving process, a lot different than adults. And are these, I know you listed a couple of these, but what are some of the other ways that children are just grieving different than adults?
Well, with young children, they don't have the words, so they don't know how to explain how they're feeling. Different from adults who can say, I'm sad, I'm depressed, I'm anxious, I'm worried. Young children often don't have those words. So we use what we call experimental and art therapy, expressive art therapy, as a way to help them express their emotions. So for example, I brought this to show you, and that's a young child who's drawn a picture of what they feel inside, the sadness and the shock. That helps them to express their feelings. Older children have the words. So older children, like teens, for example, may act out in different ways. They may be problems in school. They may act out with risk-taking behaviors. So they're very different from adults who are grieving. So
we see a picture that says sad, shocked, and so these are some of the bereavement services you offer at Calvary, and we want to say that too, to let people know that, you know, young people do have the opportunity to grieve in their own kind of way. You cater specifically in that kind of way. Share a little bit more about the services you provide. Okay.
Well, I think you have to understand a little bit about Calvary. Calvary started in 1899 and initially was for women, indigent women who were dying of cancer. Men weren't admitted into the hospital until the 1940s. The focus of the hospital has always been palliative care, and the core values of the hospital are respect for and dignity for the patient, compassion, and non-abandonment. And that non-abandonment means patients and families. And at the hospital, both here in the Bronx, as well as our satellite site in Brooklyn, and our home hospice program, our home care program, and our hospice nursing home program, all focus on patients and families. And we follow our families for 13 months. Now, having said that, all of our bereavement services are open to the community. All our bereavement services are free. So individuals did not have to have their loved one die at the hospital in order to take advantage of the services. We have many groups that we offer. We do children's groups for ages 6 to 11 called Precious Moments. We have our teen groups, obviously for teenagers. And then we have our adult groups, both in the Bronx and in Brooklyn, for those who have lost spouses or partners, those who have lost adult children, and for adults who have lost a parent. We have Spanish-speaking groups as well, and we have a men's group that I'm proud to say was in the New York Times science section about 3 weeks ago, an article about the men's group. So there are many, many activities that we offer, many groups. We're not a mental health clinic,
right.
So we don't do too much individual counseling.
When you talk about the numbers of children, teens, and youth, what kind of numbers are you seeing coming through your doors?
Well, we just had our summer camp. We have a bereavement summer camp. And Camp Compass this year was our 14th year. It's a day camp in the summer for bereaved kids, and we had 53 kids. That's children and teens. I looked at the numbers, and I think it was 2004 we had 17. So the numbers have increased greatly. And we see that. You know, you look at the newspaper, you see the demographics of where we live. Kids come with all kinds of trauma. These are not just cancer deaths.
Right.
They're certainly cancer deaths, they're illness-related deaths. There are also suicide, drug overdoses, shootings. There are all kinds of losses that these kids come into the group. And many of them have multiple losses as well.
Talk a little bit about this program here. You've got Calvary in Touch and some monthly matinees.
It's a monthly newsletter that goes out to clinicians and to our families and others that want to go on the newsletter. And certainly if you go on our website and click on that, you can get information about how to get copies of the newsletter. What's important about the newsletter is the back page of the newsletter gives you information about all the groups, who's facilitating them, you know, when is the Spanish-speaking group being held, who does someone need to call to do that. Once a month we have, it's called Friday Matinees, where we show a movie that is either related to dying or trauma or bereavement. The Bucket List for one we showed, Steel Magnolias, there's tons of movies out there. That then leads to a discussion afterwards. So for those families that don't want to do a group or don't feel they need a group, they can come participate in the movie and then have a support discussion afterwards. Before we leave, make sure we get the information out so if people want to take part in these services, not even knowing that these services existed, somebody's listening and watching right now saying, how can I be a part? How can they go about that? The website is www.calvaryhospital.org. And when you go on that website, all that information is there. All right, Dr. Sherry Schachter, Director of Bereavement Services, thank you so much for sharing with us here on Open.